Hi everyone, my name is Georgia. I've decided to set up this YouTube as well as social medias to spread awareness about chronic kidney disease. I have quite a unique perspective because like I say, I have a background as a renal and dialysis nurse, but then I have turned into a renal patient that is going to require either dialysis or a transplant, depending on how my tests go. So I just really want to spread awareness on that basis, but also to touch base that, us medical professionals are not immune to these diseases that we look after, and we all tend to ignore our bodies because we're too busy looking after other people to notice the signs and symptoms that we are having ourselves. It's also to highlight as well to advocate for yourself, because I tried to advocate for myself a little bit, but I didn't get very far, and then in doing so ignored symptoms that were getting worse, and I am now in the unfortunate position that I'm in now. But on a positive note, it means I can help spread awareness to, hopefully, if it's just one person gets tested early and finds their disease early, that they can have a lot longer before they ever need a transplant, if they ever need one. So my initial story started probably about 18 months ago. I was a dialysis nurse and I was fainting while I was on shift. I remember I was putting dialysis needle, because they're really big needles, into someone's fistula. That's like a kind of, I'll elaborate in another video, but it's a vessel that we use to pull the blood out of the machine at a higher rate so we can clean it and put it back. And I fainted a couple of times whilst I was there, and we put it down to not drinking enough and so on. And I also developed really horrific headaches. I actually then moved to a job that required a lot of computer and typing work and report writing, because unfortunately our dialysis contract had changed and we'd got a different company, and I didn't want to work the hours that new company had, so I wrongly or rightly changed to a slightly different job. But I developed these really horrific headaches, and I was blaming, because I haven't done masses of computer work since I did my nursing degree, and I was blaming these headaches on having to report write and stare at screens and so on. So I actually left that job because I thought I was blaming how I felt on the screens. In this time as well, I'd also started to feel quite sickly on a morning. I'd wake up and the first thing I'd want to do is feel like I'd want to be sick. I wouldn't necessarily be sick, but I just had the feeling of wanting to be sick, and this was every single morning. And the headaches had got to the point where they were waking me up in the middle of the night, and I was having to heavily medicate just so I can have a normal night's sleep. I then thought, right, I need to do something about this, so went to the GP, this is probably 18 months ago, and said, right, I actually got my friend to take me because my headaches were that bad I couldn't see. So I had to get one of my colleagues to drive me to work, to the GP, because I couldn't safely drive because I couldn't see. And I presented with these headaches. I had really high blood pressure. I think it was around about 160 systolic over 110 diastolic, which isn't horrific in terms of if you're in masses of pain, but still not great if it's like a long-term blood pressure. So the GP did loads of neurological tests on me, and he said, yeah, right, I think you've got migraines. You've got this medication, sumatriptan and blah, blah, blah. And I said, right, but what about my blood pressure and what about my nausea? And he said, well, your nausea probably to do with the pain that you're in every day from your headaches. The blood pressure is probably because you're worried and anxious about your pain. So when people are in pain, they've naturally got higher blood pressure. So he said, I think you're quite anxious about your pain. So I was like, whatever, I get anxious, but as does everyone, not to the point where I thought I needed medication for it. But he said, I'm going to put you on propranolol, which I kind of probably rolled my eyes at, because I know what propranolol is, and it actually was primarily made as a cardio drug, but it's rubbish as a cardio drug. So they then second lined it to treat people with anxiety because it helps, obviously, to beta blocker, and it helps with panic attacks. So I did take it to amuse him, but obviously it didn't work. So my blood pressure didn't work, and I kind of went back twice via e-consult and said, look, the sumatriptan is helping, however, my blood pressure is actually not improving and I'm a little bit worried about it. And he just never really addressed, like, he just kept putting the anxiety medication up, and I just thought, you know what, I'm not taking it because I'm not anxious and it's not improving and you're not listening to me, and I know that you're prejudging me a bit. He did actually send me for a CT scan in case it was a tumour. However, at no point in all of this, with the sickness and the blood pressure or anything, and telling him that I couldn't eat and I think I'd actually lost a stone at this point, he didn't think to do any bloods at all, which I think is a bit bizarre. And when I spoke to my consultant, my renal consultant, even he said, like, he'd done you an MRI scan of your head but didn't do basic euthanasia, which is like £100. But fair enough. So because he was ignoring me, rightly or wrongly, I then got irritated and thought, well, if you're not going to listen to me, I'm not going back. I didn't get a second opinion, I should have, but I didn't. Fast forward on another 7 or 8 months, the headaches had gotten worse. It was now daily. I started to eat less and less because of my nausea was starting to last till 2-3 o'clock in the afternoon, and I was actually at this point dry retching, and I wouldn't be able to eat anything because it would just come straight back up again. And I'd gone to work one shift, and I would remember being on the phone to a patient advising, and I just remember looking at my colleague, who I, funny enough, used to work in with, he was also a dialysis nurse when I was, and I just collapsed. It was then agreed when I come back round that this is getting beyond a joke and I need to go to urgent care. So rightly or wrongly, I finished my shift as a typical nurse would, and then went to urgent care. Urgent care, my blood pressure was 220 systolic over 160, or was it possibly 140 diastolic, which is stroke or heart attack territory, well aware. And they were quite concerned because they were pumping me full of drugs and nothing was bringing this blood pressure down. So they admitted me. I was given like an IV drug in like a HDU setting to slowly but surely bring my blood pressure down, but this come with a lot of side effects for me. Constantly throwing up, feeling completely lethargic. I didn't get out of bed, I don't think, for 2 days. When I did, I nearly collapsed, so they had to put me back in bed. It was not a great experience for me, but obviously in this time they'd done loads of urine tests and loads of blood tests, and this is when they found it an issue with my creatinine levels. So creatinine is the thing that they measure kidney function on, and when there's a higher than normal amount of it, it means usually that there's something not right with the kidneys, and mine was way above normal. As well as in my urine tests, they were dipping my urine. I've got like a little urinalysis machine in most departments, and that's shown that my my protein levels were 300, like maxed out at 300, so they couldn't measure beyond what was actually in it because I maxed out what the maximum that it could measure. So we didn't know how much protein, but we just know it was off the scale. They decided to get renal involved, which I was really happy about, but they brought in an external renal department because they didn't have their own in the hospital I was in, and they, funny enough, contacted my old department that I used to work in. So one of my older consultants that I used to work with, he come and seen me. We did a really thorough assessment, got down to the nitty-gritty, went through all my symptoms, and he said, right, okay. So he gave me a plan, put me on some medication to lower my blood pressure at home, because it's been about a week at this point in hospital. I was ready to go home. And he said, if they don't improve, your kidney function doesn't start rising, we are going to have to do a biopsy. When my bloods weren't improving, I knew at that point I had something chronic. I just didn't know what. So we did the biopsy, and the biopsy found something called IGA nephropathy. It's in short term, because I'll expand in a different video. Basically, you have immune cells, IgA and immune cells that tend to sit in the first line of defence areas, such as your snot, saliva and so on. and for some reason your immune system then lets them congregate, because they're oddly shaped, congregate in the kidneys, and we have something called nephrons, which are tiny, think of them as tiny little filters, and when they get stuck in nephrons, they damage them and put holes in them, and so on. You have millions of nephrons, but the more that get damaged, the less kidneys work. So obviously this has probably been going on with me for a couple of years. It can't have been going on for more than three-ish years, because I had my bloods done a couple of years ago, and I think 3 or 4 years ago, and there was nothing wrong with my kidneys then, so we think it's happened in that time. But that is what I was diagnosed in, and I was found in very, very late stage 3, however very, very, very quickly progressed to stage 4, and I am now at nearly the end of stage 4. I've got a kidney function of around 18%, give or take, because I am on medications that can sometimes create a slightly raised level more than what you are, but that's to be determined. But I'm sitting apparently around 18%. You hit stage 5, which is when you, in that stage, at some point will need dialysis or a kidney transplant when you hit 15%. So I don't know how quick I'm going to move, but I do know I've lost 14% of my function roughly in around 8-9 months. So as you can see, that's probably going to be heading south. I'm hoping to get a transplant before then. I've got family and friends that are getting tested. But if not, obviously I'll be going on dialysis, and I am hoping, if that is the case, that I can get a line put in, a central venous catheter, which usually goes around here, and then I'll be able to do dialysis. I'll dialyse myself from home, which is the ideal scenario for me if I was to head in that direction. But kind of the main thing I just want to highlight out of this is the ability to speak up for yourself. So I should have asked for a second opinion. The sumatriptan he put me on for my migraines was actually counterproductive, because you shouldn't give it to somebody with high blood pressure. So there's that issue there. And I was mad at my GP for some time, but actually they are general practitioners, and they don't know everything, and it's about educating them to think kidney, about anyone, think kidney, you know, headaches, blood pressure problems, weeing more often, you know, various different things, because I wee a lot. That was another one, weeing a lot on a night, and I never really considered that. So it's about getting people to think kidney. And if I, as a medical professional who worked in the field, didn't pick up on the symptoms of kidney disease on myself, what chance has the public got of picking out these symptoms, or people that don't, you know? And it's just about raising awareness that us medical professionals think we also are immune, and we are sadly not. So like I said, the main symptoms I had were feeling sick on the morning, chronic headaches. I mean, they were relentless. They still are. I still get them quite badly now, because we still to this day are trying to titrate blood pressure medication. It's I'm on losartan, amlodipine, and I'm on other things as a protection measure as well, but they're still not, my kidneys, my blood pressure is still not low enough, so that's causing further damage. But yeah, so all of these things, weeing more in the night time, swelling, so my eyes occasionally swell, never ever considered that either. Feeling really tired, so I felt tired for some time, but because I work 2 jobs, I just put it down to I was tired from 2 jobs. Really tired, becoming a little bit out of puff, so I'm anemic now, so that's probably why I get tired as well as feeling out of puff. But things were a lot harder for me suddenly, and I blamed like long COVID. I thought, oh, it's long COVID, you know, I had COVID, and everyone kind of developed like lethargicness, and so I genuinely like put it down to all of that. But yeah, so spread awareness, guys. Advocate for yourself. You know, it's a difficult process, and some people are too nervous to go to the GP, but if they'd have found me a year and a half ago when I first went to the GP, I might not be at this advanced stage. There is so many, well, it's not treatments, it's incurable. However, there's so many things they can do to slow it down if you're caught early enough. Unfortunately for me, it hasn't been caught early enough. I was found quite late on, and the unfortunate thing about kidney disease is when you start getting symptoms, it's usually you're kind of starting to advance. So the earlier you catch these symptoms and the earlier you advocate for yourself, the better chance you have of slowing things down before you ever need a transplant. So just spread the word. Don't be like me and ignore, because we spend our time looking after other people. I am going to do more videos about my journey. If I ever hit the transplant dialysis stage, I am going to be documenting that as well. I can't even believe I've done this video, if I'm honest, because I'm really private, and it's took me a long time to be able to talk about it, because for the first few months when I was diagnosed, I shut everybody out. I wouldn't talk to my family, I wouldn't talk to anyone. I was just in my house in my own thoughts thinking, why me, what have I done to deserve this? However, I genuinely believe in things happen for a reason, and I think I was here to educate people, to try and help people find this earlier, and get treatment earlier. And if I can help one person get diagnosed earlier, that either prevents them from needing a transplant or they get another 20 years without needing a transplant, then I've done my job. So spread this video far and wide, and then don't forget to subscribe and like my pages, to follow me on my journey, because I will be documenting everything. And if there's anything anyone wants me to talk about, please leave comments and I will hopefully be able to do videos on that. But thank you for listening, and I hope that you follow me on my journey.